Good evening, everyone, and welcome to today's webinar hosted by TrueLearn. To actively participate in today's event, you can use the chat feature located at the right-hand side of the screen, as well as weigh in to polls that we have appearing at the bottom. We encourage our viewers to ask any questions to today's presenter, and you can do so with the question pane located at the bottom of the screen. We'll collect all of those and address them at the Q&A portion at the end of the session. I would now like to introduce our presenter, Dr. Taylor Brana, a psychiatrist with a passion for teaching. He has several podcasts and is the co-founder of the first voice interactive medical question bank, MedFlashGo. Thanks for being here with us today.
Hi, how's it going, everyone? I hope you can hear me okay. I am Taylor, and I'll be finishing up my psychiatry residency in about a week. I'm also going to be taking the ABPN exam. So this is coming from a perspective of someone who is actively preparing for this examination. I have spoken to several other individuals who have taken the exam, and I've looked through all the materials. So if there's any basic questions around the ABPN exam, I saw there's also some questions about the PRITE as well. I can try to answer that to the best of my ability. But today what we're going to go through are some practice questions through the TrueLearn databank and database. We'll go through some of those questions. But before that, I just want to have everyone try to say hello or say hi in the chat. I hope I'm not just speaking to an empty room. And if at any time you guys have questions, please feel free to send them in the chat. I'm also going to be asking for people to participate in questions. So as you guys are seeing the questions that I'm seeing, I would love for you to give a guess as to what you think the correct answer is. I want to see some of that participation because that's going to really make you be more active in this webinar. There's going to be polls that come up for each question so we can get a poll or a sense of, what you think the answer is. So I'm going to go ahead, and when we go through these questions, I'm going to wait and pause just to see if we have some participation. I'm going to make sure that you're taking a look at the question, and then I'll give you sort of my thought process as to what answer I would pick. I'm not telling you it's going to be 100% the absolute best thought process. It's just the way I would go through it or think about the question. And I hope we'll have some good discussion. Again, with any exam, it's all about practice, 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 doing lots of questions, doing lots of review. But I'm going to start with a little bit about the ABPN exam. So for this exam, remember, this is the American Board of Psychiatry and Neurology exam. And I'm actually going to switch over and show you guys the blueprint so you guys can get a sense of that as well. So let me just share my screen. There were a lot of questions beforehand about the blueprint for this test or what it's going to be on. So let me switch over to that. And I'll share. And you guys can see that this is the certification exam for psychiatry. And if you go to abpn.com, you can literally search the 2021 content blueprint. And of course, if you're going to be on a different cycle or you're going to switch over, you can go to the 2022 cycle. They're going to have a different breakdown. So we're going to have developmental processes, neurodevelopment disorders, substance-related, and addictive disorders. So I don't want to read through all of this, but you guys can go onto the website and see this breakdown just so you know kind of what's going to be covered on this test. But I want to point out some larger areas here. Notice that substance-related and addicted disorders, that's going to be 7 to 11%. Schizophrenia spectrum and other psychotic disorders are going to be 8 to 12%. Depressive disorders are 8 to 12%. So those are the lowest hanging fruit, meaning those are just the largest percentage of topics. So when you're considering this exam, just remember to, be sure to check, those certain areas of the exam. And again, there's just going to be different breakdowns. So that's this dimension 1 psychiatric disorder and topics. And if we scroll down here, we get this dimension 2 physician competencies and mechanisms. And you can see there that, for example, here, neuroscience and mechanisms of disease, huge 17 to 23%, and treatment is going to be 25 to 35%. clinical aspects of psychiatric and neuropsychiatric disorders, 17 to 23%. So again, I don't want to read through all of this, but again, just want you guys to be aware of the blueprint that is on abpn.com, and you guys can search that as well. And this exam is 425 questions, so it's a pretty long exam. So I'm going to stop the sharing of the screen for now. I'm going to give you guys a little bit more about the exam before we head into these questions. Just so you know, again, this exam is going to be 425 questions. You're going to get 60 minutes of pooled break time. So what pooled break time means is after every section that you complete, there's 8 sections, and after every section that you complete of this exam, you're going to get to choose how long your break is. So you essentially just get a pooled break time. After every section, it allows you to take that break. You can take a 5-minute break. You can take a 10-minute break. You can take a 30-minute break. It doesn't matter how long you take, but that's your total amount of break time. So for example, you might want to do two sections, take a 10-minute break, do another 2 sections, take a 40-minute break. Then you do 2 sections, take a 10-minute break, and then the other 2 sections, right? So you might want to, however you want to disperse it. But once you've used your pooled break time, now you're in negative time, which means that anything after that, you're taking away from the amount of time you have to take on the exam. Section 1 is 68 questions. Then you'll have an optional break. Section 2 is 38 questions. Then you'll have an optional break. Section 3 is 68 questions. So it keeps alternating between 68 questions, which are standalone questions, and then it'll go to a section which is 38 questions of linked item sets. And I'm not going to explain that right now. You guys will see some examples of that in a second. So there are different types of questions. There's standalone questions, and there's linked item sets. And if you guys are confused, please also ask that question in the chat. I'll try to explain it more. But let's go ahead and go into some questions. And again, if I'm going too fast, please try to slow me down. Just let me know, okay? So now we're going to go into, I'm going to share my screen here, and we're going to go into some questions. And again, please participate. That'll make me feel like I'm less alone here. And we'll go into some of these questions. Cool. So, all right. Okay, let's do this. Okay, perfect. So I hope that you guys can see the question that's popped up here. And there's a poll that is going to pop up that you guys can answer for this question, okay? So the question reads, the neural tube is the embryologic structure which forms the brain and spinal cord. Which germ layer gives rise to the neural tube? Is it A, ectoderm, B, endoderm, C, intermediate mesoderm, D, lateral plate mesoderm, or E, paraxial mesoderm? So I'm going to wait on this question. I'm going to give us like a 30 seconds to a minute. And I want to see what people have to say about this question. So I'll wait a little bit, see if we get some votes on what you guys think. And you can vote in the poll. So I see a couple of votes in here. I see 3 votes, 4 votes. I'm going to give us another 10 to 15 seconds, and then I'll go into some of the thinking around this. All right. You guys got to lock it in. 5, 4, 3, 2, 1. Okay, perfect. Thank you guys for voting. So I see that a lot of people chose A. We got a vote for B, and we got a vote for D. So let me go through the thinking on this one. So embryologic questions are never fun. This is just essentially something you have to kind of memorize. I definitely wasn't the type of person that looked forward to learning all the developmental processes going on. But remember some really, really basic stuff, okay? Even if you have no idea what the answer is, just remember that the ectoderm is the outer layer, and the ectoderm is usually, you usually think about things like the epidermis or skin. You can think about glands of the skin. And actually, the ectoderm also develops into the neural ectoderm. So there are neural structures that are derived very early on from the ectoderm. Remember that the endoderm is kind of the opposite. That is the lining of our digestive tract. It's the lining of our airway. You want to think about digestive glands, internal, GI structures. And then we can go into kind of the middle, which is going to be our mesoderm. You want to think about mesoderm for connective tissue, bones, bone, cartilage, blood, endothelium, muscle, kidneys, and lining of the gonads. But the correct answer in this case is going to be A. And that's again because the ectoderm has to do with the epidermis, has to do with the neural ectoderm, which is gives rise to the brain and the spinal cord. And that arises through the folding of the neural plate. So if there's a question about the peripheral nervous system, the ectoderm gives rise to the neural crest, which gives rise to the peripheral nervous system. So anyways, not really much to do here, but just remember that those are kind of the areas. So in broad strokes, you just have to know the basics of ecto, endo, and mesoderm. To go a little bit deeper, the intermediate mesoderm gives rise to the kidneys and the reproductive system. So if you guys want to take some notes, remember that the intermediate gives rise to the kidneys and reproductive system. The lateral plate mesoderm gives rise to adipose tissue, blood, lymphatics, heart, and spleen. And the paraxial mesoderm is specifically for bone, cartilage, and the skeletal muscle. Okay, so if you guys are having a tough time remembering all that stuff, just remember the broad strokes: ecto for the dermis and skin, endo for the GI structures and lung tissues, and the meso connective tissue, cartilage, bones, all of that good stuff. Make sense? I'm going to move on to our next question. And again, if anyone has any questions, please just pause me, slow me down, and I'll try to go through this. But I do want to give us the most bang for our buck here. All right, question number 2. So we're going to have a new poll for this one. So let's get ready for question number 2. A 17-year-old girl presents to the clinic for follow-up. She details that since starting college, she has had to find her new place within social groups via developing new friends, cliques, and making a name for herself at this new school. At the time, she has pursued a relationship with another individual at college and has developed a sense of fidelity toward him. According to the Ericksonian life cycle development, the patient is most likely in which of the following stages? Is it A, autonomy versus shame and doubt? B, identity versus role confusion? C, integrity versus despair? D, intimacy versus isolation? Or E, trust versus mistrust? So I'm going to give everyone a minute to think about this. Again, we're trying to figure out the Ericksonian life cycle development stage. Which stage are we looking at here? And I'm going to give us about another, I'm going to say 20 seconds here. Sorry if I'm not giving you guys enough time. I just want to make sure that we get through all of the questions. And another 10 seconds. I see people are voting. That's great. Okay, so let's close it out there. So guys, for this question, it's really important to essentially know the general gist of which stage we are in regards to Ericksonian stages. So there is a really nice table that if you go through TrueLearn and you're doing the questions, there's different ways of kind of remembering this or thinking about this. But you just want to know in order the general ages to remind yourself of which stage we are in. and certain characteristics of those stages. So I'm going to go through all of the stages really briefly. And again, if you're taking notes, you can listen along, or if you just want to listen, we'll go through them. So remember that trust versus mistrust is a stage from birth to 18 months of age. Okay, so trust versus mistrust, which is E, is not the correct answer. That's going to be from 0 to 18 months. Okay. Autonomy versus shame is the next one. Autonomy versus shame is between 18 months to 3 years of age. So that answer choice is obviously out. Initiative versus guilt is the ages from 3 to 5 years old. And that's not even an answer choice here. Industry versus inferiority is between the ages of 5 to 13 years old. So we're not even in that group, but that's not going to be the correct answer here. Identity versus role confusion is between the ages of 13 to 20 years old. So that could be a correct answer because we have a 17-year-old here. And again, identity versus role confusion is B, which 3 people said that one. And a large group said intimacy versus isolation, which is D. And intimacy versus isolation usually falls between the ages of 20 to 40 years old. The next group is generativity versus stagnation. That's 40 to 60 years old. And integrity versus despair is over 60 years old. So C is out because that's definitely at the end of the spectrum. So we're really down between identity versus role confusion and intimacy versus isolation. Now, I'll be honest with you guys. When I did this question, I thought the answer was going to be D, intimacy versus isolation, because this is a person, developing an intimate relationship. However, the correct answer is actually going to be B, which is identity versus role confusion. The test is looking for us to know the specific years of age where these stages occur. And a sense of fidelity, the term fidelity is building trust with someone, but building trust and fidelity is a key indicator of identity versus role confusion. If this STEM or question were saying that this individual was falling in love with them and they had built trust already and they were getting a sense of each other, that would be further along in the stages, and that would be more of an intimacy versus isolation response. But again, I think the exam is really looking for us memorizing these ages. So I know it's kind of nitpicky, but the correct answer is identity versus role confusion. And really, you'd be down to those 2 answers, which it seems like that's where people were at. So again, we have to memorize that table, just have a sense of when things fall into which age groups, and then be able to determine at least getting our 50-50 shot on getting the answer correct. But in this case, it's identity versus role confusion. And it looks like a lot of people were stumped on that one. So
we had a question come through. Would we be able to address that really quickly?
Sure.
So do these Erickson questions ever break from the standard age brackets?
I can't tell you for 100% certainty, but I will say that in general, on any boards exam, the reason they give the specific age is because those are the stages, right? That's how it's defined. They're not trying to write questions to trip you up. And just so you know, if there's questions that do try to trip you up or go outside of the quote definitions, those are questions they will most likely throw out, which they do in regards to boards exams. So 9 times out of 10, just assume that they're not trying to trick you and they're literally leaving this information in because of they're leaving that information in because they want you to choose the correct stage based on the actual stages. So I would make the assumption that they're not trying to trip you up. If, again, they're trying to trip you up, you got to realize most people are going to be confused and they're probably going to throw out that question anyways. All right, so we're going to move on to the next question. Okay, let's get ready. I'm going to give everyone a minute to give the responses for the poll. In the Maslow hierarchy of needs, Maslow described several criteria that defined deficiency needs. Of the following, which is true regarding deficiency as defined by Maslow? A, deficiency needs stem from a desire to grow as a person. B, the order of achievement of deficiency needs always follows the same progression. C, self-actualization is a deficiency need. D, under free choice situations, the basic need is preferred by the deprived person over other satisfactions. Or E, motivation decreases when deficiency needs are not met. So I'm going to give you guys like 30 more seconds to respond and figure out what you think the answer is. All right, and we'll go for maybe another 20 seconds here. I know this question the phrasing is a little bit confusing, but just give it your best shot. All right, so let's go ahead and try to answer this question. So if you guys remember the Maslow's hierarchy as that pyramid, at the very bottom, we have our basic needs like food, water, warmth, rest, and safety. If we go up another level, we're thinking about the psychological needs of a person like belongingness, love, relationships, friends, building self-esteem, having a sense of accomplishment. And then at the top of the pyramid, we have self-fulfillment, which is achieving one's potential, including creative activities. So when we're talking about this idea of a deficiency need, we're really looking at the lack of our basic needs. So if we look through these different answer choices, I'll go through them one by one. A, deficiency needs stem from a desire to grow as a person. That's not the definition of deficiency needs. A deficiency need is kind of these base things or needs that we need to survive. B, the order of achievement of deficiency needs always follows the same progression. That's not what the Maslow's hierarchy suggests. Self-actualization is a deficiency need. No, self-actualization is at the top. That's not a deficiency need. That's kind of the extra level or layer to it. So C is not correct. D, under free choice situations, the basic need is preferred by the deprived person over other satisfactions. So D is true. Under free choice situations, basic needs are always preferred by the deprived person. You need to meet your basic needs. Otherwise, the needs higher, like the psychological needs and psychological and self-actualization needs, will not be fit. If you don't have safety and food and water and all those things, you're not going to be searching out for things like love and creative opportunities. And then E, motivation decreases when deficiency needs are not met. E might be true, but this is one of those types of questions where D is just more true or is more in line with what they're looking for. So deficiency need is basically a lack of basic needs. I know this question has a weird phrasing in it, but that's just basically what that means. So D is the correct answer in this case. Sometimes on these tests, the way things are phrased are confusing, and we just have to find the answer that is just the most correct. So that would be the answer choice I would choose. All right, and we're going to go on to our next question. So for these next questions, there's going to be a video. So I'm not sure why some of these answer choices were filled. So for these questions, I'm going to try to play this, but I want to make sure you guys can hear it. So I'm actually going to close out sharing my screen for a second, and I want to reshare, making sure you guys can see hear the audio. So let me just double check here. Okay. And let me know if you guys can hear the audio on this. Are we able to hear the audio?
Nothing's coming through.
Nothing's coming through. Let me just double check the settings on here. Sorry about this, guys. Guys, please bear with me. All right, let's just make sure. Oh, I see here. Share audio. All right, guys, I think now the audio should work. So I know this video is small, but you really just want to listen to the audio on this, okay? So let me see if we can get that audio going for us.
So what brings you here today?
Sounds good.
What's going on?
Well, Alicia, the girl I've been seeing, I broke up with her.
Okay.
Well, she's crazy. We were out at the bar, and she ends up. I ordered food. We sat down. We ordered food, and she disappeared. She went up to the karaoke machine, and she started giving them whatever songs. And then I'm sitting there. I'm hanging out. I'm drinking a beer, and I'm like, where the hell did this girl go? I turn around. She's not at the machine anymore. She's talking to a whole group of guys. And I was like, what the fuck? And that bothered me, but it wasn't a matter of jealousy. It's a matter of great. And now she's going to put me in a position that the food's going to come. Now I'm going to have to go over there and tell her, come on over here. Then one of those guys is going to say something because she's probably playing them. And then I have to defend her honor or I'm going to get into an altercation. And I just really don't need this crap right now. Whatever. Anyway, the food ended up coming. She's still not there. Then she walked up, and I'm just eating silently. And she goes, what's the matter? And I said, you know what? I'm mad at you. I'm mad at you because we came here to eat, and then you just left me, and you went over there and just talked to these guys. And now you put me in a position that I have to now either get into a fight or an altercation. And I'm not looking to do that. So I'm aggravated. And you know what? I want to go home. So as we're walking out the door, all of a sudden, this girl has a temper tantrum and kicks the door out. This is my friend's place. Like, great. Now I got to explain this to my buddy. And then she kicked it again. Kicked it. Slammed it all the way open. And so anyway, we get in the car, go home. And I'm trying not to have a conversation with her about this because she's drunk. And I've had a few too. So I'm debating it. And then next thing you know, she just leaves. And then I don't know where she goes. She comes back the next day and she said, oh, I was just mad. She slept on the couch. I was like, you know what? This is it. It's over. Can't do it. And so ending that and knowing her past, that she's freaking a little bit nutty, I ended up putting towels all over my windows. I ended up taking my doggy door and locking it and actually screwed it down so you can't open it up, so you can put your hand in there. And the towel, so she can't see in and out of the house. And then I double locked the door because when I come home, I'm afraid that she might just jump out of the woods because her ex-boyfriend, who happens to be a friend of mine, don't ask me why I dated him, but I should have known it then, said that she just jumped out of the woods and she roundhouse kicked him. And then she started hitting his car. So that's why I'm in my head. I'm just thinking that she's going to end up doing this. And then, so at night, I'm not sleeping because if the dogs make a noise, because now I got to make sure that they're able to go in and out of the house. And now they can't. Now I got to open up the door. And when I open up the door, is she going to be there? She's a nightmare.
All right. So you guys watched that 3-minute video. Now it's important to watch these videos all the way through. And you might feel like you're wasting time, but this is a question set of 6. So 6 of these questions are going to be based on that one video. These are linked questions that you will see on the ABPN examination. And the reason this is important for me to stop everyone here is because regardless of what choice you choose here, notice that this question is asking for choosing 3 answers. So you have to choose 3 answers for this. And the other thing I want to clue you in, guys, on is once you answer this question, you can't go back. You can't change your answer choices afterwards. So once you choose your answer choices, you really do lock yourself in, and you have to get all 3 answers correct in order to get the question correct. There is no partial credit for these questions. So of the following, which diagnosis do you include in your differential? So I want you guys to, answer in the poll. I don't know if we can do multiple answers in this poll, but regardless, just choose answers that you feel possibly could fit the video you're seeing. And then we're going to give some answers on here. Okay, I'm going to pick, quote, the top 3 that we might have seen. So what's on your differential for this video that you just watched? I'm going to give us, let's go for another 15 seconds, and then we'll go on to the next question. All right. So basically for this question, again, we're looking for our top 3 diagnoses or things to look for in terms of our differential. So remember that he was at this bar with his girlfriend and they're having drinks. So you can't really rule out alcohol intoxication. So that would definitely be one that we talk about. And then her walking away and all that stuff that he was mentioning. If you noticed at the end, closer to the end of the video, he starts getting into these sort of paranoid thoughts and thinking, going off on like having to shut the door and drill in and put a towel over the door or the windows so she can't see in, and something about roundhouse kicking previous boyfriend. It kind of goes off on like this sort of whatever area, but there's a lot of paranoia involved in that. So that sort of makes me think more so of this potential schizophrenia or schizoaffective or schizoaffective disorder. Schizotypal, he's not really having odd dress or odd mannerisms or magical sort of thinking. So I'm not necessarily going down that route. Also, schizotypal or personality disorders is usually, you have to rule that out after other potential disorders, right? So those are some of the things that I'm thinking about. Obsessive compulsive disorder. I don't really think that how he's behaving is related to these ritualistic sort of patterns. It seems more so associated with the event with his girlfriend, but it's coming out of a sense of paranoia. So I don't know if that's necessarily a good fit. So as you guys chose these answers, rightly so, I would go with A, B, and E myself. And I hope that kind of explanation helped you guys. And again, if you're confused about any of these answers, just let me know. We'll go back. All right. Now I want everyone to close their eyes for a second because I might have some of these answers might be answered. So let's reset the poll. I'm going to go to the next question. And I'm going to just click some things off in case it pops up. Okay. Let's just imagine that these aren't answered already. All right. So let's go back to the poll and we're going to go to question number 2. Of the following, which diagnoses do you include in your differential? So choose 3. So again, this question's a little bit weirdly phrased, but which of these 3 things that you see on this list do you believe are most likely associated with the video that you saw? What kind of what signs were you seeing, or what were you noticing in this patient? And we'll give you I'll give you guys 30 seconds. And you have to choose 3, but for the sake of the poll, just choose the one you think you most saw. All right, I'm going to give us another 20 seconds here. All right, guys. So let's go ahead and I'll give you kind of the general thinking for this. Just remember that for this specific question, they're just asking like, what are some of the things that you saw from this patient in regards to their thought process, thought content. And so he did not mention hallucinations. I did not see that really. Obsessive thought process. Maybe not. I don't necessarily think that he was potentially, but I think it felt more like it was in the realm of paranoia, how nervous he was about this girlfriend and what she'd done in the past, and that he might get roundhouse kicked or something. So I think the D definitely fits in more than the obsessive thought process. Pressured speech, maybe, maybe not. The one thing I would have loved to have seen in this video is maybe the interviewer trying to ask something and then it being difficult for the individual to, it being difficult for us, for the interviewer to really get something in. That would have made me feel stronger about the pressured speech, but possibly pressured speech. E, tangential thought process. I think he was kind of all over the place at the end. I see Gina said that she can't read the answers. I'm sorry. So the answer choice is A, hallucinations, B, obsessive thought process, C, pressured speech, D, paranoid ideation, or E, tangential thought process. Sorry about the text, guys. So I think D fits in really well. And E, I think he did have tangential thought process. He was kind of all over the place at the end, going on different kind of ideas, and it seemed a little bit difficult to follow. So I would go with tangential. It happens to be that they want us to look for 3, and of the 3, I think pressured speech, he kept going on and on about different thoughts, and he was continuously moving. And so you may use pressured speech as another one here. And I think pressured speech is better than obsessive thought process. So that's why I would choose C in this case. So yeah, let's go on to the next question. And again, guys, just close your eyes for a second because some of these might be answered. I apologize for that. All right. So our next question is, at your initial evaluation, you opt to use tests and screening tools to aid in your diagnosis. Of the following, which will you use? Choose 3. So we're going to reset the poll, and you guys get to choose A, neurologic consult, B, blood alcohol level, C, the dimensional Yale-Brown obsessive compulsive scale, D, the Young Mania rating scale, or E, the SCOFF inventory. And Jimmy asks, at any point, can you replay the video? Guys, just in general, do you want me to replay the video? It's kind of long. That's the only reason that I didn't necessarily want to do that. But do we feel like we want to rewatch the video again? Am I getting multiple people that want that? Otherwise, what I'll do is we'll go through the... Oh, at any point, can you replay the video on the exam? Jimmy, yes, you can replay the video. But just remember, again, like this is a long video. So if you're going to spend, 3 minutes rewatching the video or skipping through it, you can do that. But you just want to be cognizant of time. Okay. All right. So at your initial evaluation, you opt to use tests and screening tools to aid in your diagnosis. So answer choice A is neurologic consult, B is blood alcohol level, C is the dimensional Yale-Brown obsessive compulsive scale, D is the Young Mania rating scale, and E is the SCOFF inventory. So you can choose 3. Which ones are you going to choose for this patient? And I'm going to give us another 15 seconds or so. All right, guys. So let's go through this. And the one thing, again, I want to remind you of is on the test, you have to get all 3 right to get the question right. So even if you get 2 of the 3 correct, if you miss 1, unfortunately, you miss the points. But everyone's in the same boat, so it is what it is, unfortunately. So for this question, a neurologic consult. So one thing to remember for any psychiatric patient is what do we need to do to rule out, or what do we need to do first before we get a psychiatric diagnosis? We have to rule out medically related diagnoses. So neurologic consult actually could be a pretty good answer because maybe we want to get like something like an EEG or just have a neurologist check out the patient, make sure there's nothing neurologically going on, something like a CT or any additional tests, right? So potentially a neurologic consult. B, we did notice that the patient seemed to be drinking alcohol. So in this case, blood alcohol level is a great choice. So I would definitely choose B. The dimensional Yale-Brown obsessive compulsive scale. So are we thinking OCD in this patient? That's definitely a possibility, but not necessarily the top of my list based on the presentation. So I wouldn't jump at C. D, the Young Mania rating scale. So we saw some things like tangentiality, maybe a sense of some pressured speech. So we can use the Young Mania rating scale potentially, which is an 11-item scale or screening tool that we can use to check for symptoms of mania. So I think that is definitely a good tool to use. And guys, the SCOFF inventory, I had to look this one up because I don't use this regularly. The SCOFF inventory is used for eating disorders. And that's an inventory you can use for eating disorders. But in this case, this is a distractor answer. So E is not correct. So now I'm in between A and C. And of the two choices, I'm less concerned about OCD than I am about ruling out medically related issues. So the answer choice in this case is A. Again, if you were thinking about obsessiveness, you could. It seems like in this case, that's a distractor answer, and the better answer is A, because the neurologist will come in and let us know if there's anything else going on that we should be considering. I know a lot of tests, sometimes they don't want you to jump to necessarily getting a consult, but in this case, between A and C, A is just the better answer. So I know that can trip some people up. I actually probably would get this question wrong. But again, this is what they're looking for in regards to this question. And I'm going to move on to the next one. And again, just close your eyes briefly. And I'm just going to reset the question. And I'll go ahead and then read the answer. So just close your eyes for a second. I'm going to close off some of these answer choices. All right. So in this case, no, I don't have to do any of that. So we have a longer stem here, and we're going to reset the poll. And we're going to go into this next question. So number 4, you obtain additional information from your evaluation. You learn that he was brought in by the police after he applied repellent around his apartment complex and told the police that the rat poison was his attempt to prevent his girlfriend from reaching his apartment. The patient denies any medical conditions confirmed by his sister. You learn from his sister that their father was diagnosed with schizophrenia. So definitely important there. The patient denies all of the history provided by his sister. He states that he has used no drugs but occasionally drinks alcohol. His clothes smells like alcohol, which he denies consuming recently. The neurologic evaluation is reported within normal limits. A brain MRI shows no abnormalities, and an EEG was normal. His urine and serum alcohol and toxicology screens are negative. That's good too to know. Routine labs, HIV and syphilis are all within normal limits. His score on the Young Mania rating scale is high. He denies SI, HI. He denies suicidal homicidal ideations. The man's symptoms are significantly interfering with his social and occupational functioning. From this information and your evaluation, you diagnose which of the following. So what do you guys believe the diagnosis is for this patient based on the information in the text? I'll give us 30 seconds to answer. Correct. And the A is alcohol intoxication, B is bipolar disorder, manic, C is schizoaffective disorder, D is major depression disorder, and E is general anxiety disorder. All right, I'm going to give us like 10 more seconds. All right. So this is a tricky question, and I see that we're locked in a battle between B and C, between bipolar disorder, manic, and schizoaffective disorder. So it's not alcohol intoxication, because if you look back up here, his urine and serum alcohol toxicology screens are negative. He does have alcohol, his clothes smell like alcohol, so maybe we know that he has been drinking, but there's just other things that fit a little bit more, especially after in the prompt, we're learning that, he's applying repellent, and he told the police that there's rat poison. That was his attempt to prevent his girl from reaching the apartment. There's a lot of paranoia here, right? So, and then we also have this family history of schizophrenia here. So a lot of paranoia and a lot of so alcohol is just kind of not really fitting here. Bipolar disorder, manic, we could go for that, right? Because of the tangentiality, the pressured speech. And maybe we're even thinking maybe this is a bipolar disorder manic episode with some psychotic features going on, right? So that's something that we could think about. And this also, the Young Mania rating scale here is high. So that could definitely be a potential answer. Schizoaffective disorder. So we have the schizo part with the paranoia. We have the family history of the schizophrenia. We have a lot of paranoid delusions going on. So that's kind of there. And then also the affective part in this case, is the mania type stuff that we're seeing. So this looks like a pretty good answer. D, major depressive disorder, not really a depression picture here. And general anxiety disorder, again, we just have other choices that fit better. So it really is between B and C. I was stumped on this one myself. I wish they would have provided more of a timeline, because as you guys remember, that schizoaffective is diagnosed via having the psychotic features of this patient going on for 2 weeks without the affective component. So it can be tough, but because this answer is not discussing the psychotic features and it's saying strictly bipolar disorder, manic, technically the answer that they were looking for was actually schizoaffective disorder. Now I know it was in between both, but just with the family history, the increasing paranoia, there is no mention of the lack of sleep or changes in energy, and all of those things. So there's some things pointing against it. Again, this manic scale can still be high in schizoaffective disorder. So there's just a little bit more, there's more points for the psychotic part of this question. Now, I know this one's super tough. I would have probably gotten this one wrong, but the correct answer choice is C, and we were split on this one. But I wish that the STEM had a timeline that would make the answer choice more clear, but it doesn't. In reality, can we really make this diagnosis based on this prompt? No, we need to have more information, but based on this prompt and what we have, schizoaffective is just, we have more points towards this being a primary, more of a primary psychosis first. And we just don't have enough information, but that's what they're looking for. Sorry, this one's tough. So that's the correct answer, unfortunately, if you got it wrong. All right, and we're going to move on to our next question here. And again, close your eyes for a second. All right, we're good to go on this one. So question number 5, we're going to reset the poll. All right, following your full evaluation, you treat this patient who you have diagnosed with schizoaffective disorder. Given his history and presentation, which of the following treatments or combinations of treatments are appropriate for this patient? So the answer choice A is ziprasidone and psychodynamic therapy. B, valproate and cognitive restructuring therapy. C is lithium and psychodynamic therapy. D is palperidone and cognitive restructuring therapy. Or E, sertraline and cognitive restructuring therapy. And I'll give us 30 seconds. All right, and I'm going to give this another 10 seconds or so. It seems that this question is going by landslide here for one of the answer choices. So most of you have answered this with D. So let's just go through the answers really quick. So remember, guys, schizoaffective disorder, to diagnose this, you have to have an uninterrupted period of illness where there is a major mood episode, depressive or manic, but the delusions or hallucinations last for 2 or more weeks in the absence of major mood episodes, right? So that's what we were saying this guy has. And remember that the first line treatment for schizoaffective disorder is going to be antipsychotics. So antipsychotics are first line. So immediately we can eliminate, in this case, valproate. We can eliminate lithium, and we can eliminate sertraline. Of course, maybe these are things we could add on, but the first line treatment is an antipsychotic if that's what we believe is the primary thing going on. And now really it's a question between, do we give this person psychodynamic or cognitive restructuring therapy? And can a person that's psychotic or has schizoaffective disorder really handle psychodynamic therapy? That's an insight-oriented therapy. They will not be able to handle that. So the correct answer choice is going to be cognitive restructuring therapy, which includes things like, CBT, basically. So, trying to treat maladaptive thoughts or patterns or cognitive distortions. So in this case, palperidone and cognitive restructuring therapy is just a better answer. Ziprasidone doesn't end up working because they can't handle the psychodynamic therapy. And this one looks like it made sense for everyone. So we will move on to the next question. Please close your eyes for a second in case it's a multiple answer choice. All right. So question number 6, we are going to reset the poll and we're going to go for question number 6. Of the following, which is a condition often seen in patients with schizoaffective disorder? Choose 2. So A, tobacco use disorder, B, antisocial personality disorder, C, dependent personality disorder, D, suicidal ideations or completion, and E, weight loss. So of the following, which is a condition often seen with schizoaffective disorder? A, tobacco use, B, antisocial, C, dependent, D, suicidal ideation / completion, or E, weight loss. Please provide your answers. And you have to choose 2, but you can, in this case, just choose whichever ones you want, but know that you, in reality, you have to choose 2. And I'm going to give us about 10 more seconds to see if anyone has any more responses. All right. So basically, you just have to know what's associated with schizoaffective disorder. And you guys were split between A and D, which are the correct answers. So schizoaffective disorder, you're going to see more tobacco use, and you're going to see more suicidal ideation and completion. Remember that in this case, antisocial is not associated with schizoaffective. C, dependent personality is not associated with schizoaffective. And you actually see weight gain associated with schizoaffective disorder because of the medication use and the metabolic disorders that are associated with it. So weight loss, if this had weight gain would have been potentially correct. Okay. So in that case, good job, guys. You did really well in that one. And we're going to move to our next question. All right. Number 10, we are going to reset the poll. And question number 10, you are evaluating a 9-year-old boy with a history of speech delay and significant deficits in social interaction, communication skills. You suspect a diagnosis of autism spectrum disorder. Which of the following is consistent with this diagnosis? Okay. A, absence of stereotyped behaviors or restricted patterns of interest. B, demonstration of socio-emotional reciprocity with adequate eye-to-eye gaze. C, hyper but not hyporeactivity to sensory input such as loud sounds, pain, or temperature. D, insistence on experiencing a variety of activities and intolerance of same daily routines. Or E, lack of imaginative play with siblings and or peers. So which of the following is consistent with autism? I'm going to give you guys 30 seconds. All right, another 10 seconds. It's okay, guys. Whatever you choose, it's fine. This is a learning opportunity, so just go ahead and answer. All right, so let's go through the answer choices. Answer A, absence of stereotype behaviors or restricted patterns of interest. So that's false. There are stereotyped behaviors and restricted patterns of interest. My brother actually has autism, and he is absolutely in love with technology and anime, and he has very specific interests. And the stereotype behaviors are very specific behavior patterns that can be seen with autism. So A is false. B, demonstration of socio-emotional reciprocity with adequate eye-to-eye gaze. That is not true. People with autism have difficulty with social dynamics and socio-emotional reciprocity, so that's not true. Hyper, but not hyporeactivity to sensory inputs such as loud noises, loud sounds, pain, or temperature. So this is false because they can have both either hypo or lack of reactivity. So both hyper and hyporeactivity are possible. So C is false. D, insistence on experiencing a variety of activities and intolerance of the same daily routines. That is also false. D, they do not want a variety of activities. And so D is not true. And intolerance of same daily routines. That's also false. They like to have very similar routines. They don't like to have variety. So they want to have things a certain way, and things that are not that way are very bothersome. And E, lack of imaginative play with siblings and or peers. That is true. They have difficulties with having imaginative play with siblings and peers because they have difficulties with their social dynamics and those responses. So remember, guys, with DSM-5 criteria, autism is a persistent deficit in social interaction, restricted repetitive patterns of behavior and interest. They have to have all of these things, clinically significant impairment in social, occupational, or important areas of functioning that cannot be better explained by intellectual disability or a global developmental delay. Okay? And they must have two of the following: stereotyped repetitive motor movements, insistence on sameness, inflexible adherence to routine, ritualized behavior, highly restricted fixated interest, hyper or hyporeaction to sensory input. So hopefully that helped you with the autism question. All right, guys, so I'm going to close that one out. And we have a little bit of time for any additional questions. I want to thank everyone for being on the webinar. And I'm going to address some questions that were sent in. But if anyone has any questions in the chat, I will also answer those as well. So thank you guys for bearing with me. I hope that was educational. And I'm going to answer some of these questions, okay? So one of the questions says, any suggestions on how to prepare or approach case vignettes? I kind of went through my thought process, but the basic thing is figure out what the question is asking, highlight relevant information. And my favorite thing to do with any case or any questions is to try to figure out what answer choices are definitely wrong. That way you have more confidence in answering the correct answer, but you guys know that. You want to increase your likelihood of getting the correct answer as much as possible. And again, guys, if you want to put anything in chat in terms of questions, just please let me know, okay? I'm a repeat test taker, but still can't pass. Any advice for repeat test takers? I don't really have anxiety issues, and I don't really have time management issues. I'm not sure what to say. I think maybe you had like some bad luck if you studied well. I think the most important thing is to review all the topics, go to the blueprint, use resources like TrueLearn or online resources where you can review important topics, do a lot of questions, and that'll increase your likelihood of getting answers correct. But I don't have any specific tips except for, just try your best and study as hard as you can, and hopefully you're able to narrow down those answer choices a little bit more. Next question, how does one get started studying? And if I'm planning on taking the boards in September and I'm working full time, what might be a good strategy to to prepare for test day? I think you just got to do lots of questions, build up your endurance. There are a lot of resources like TrueLearn and different question banks you can look up online in terms of resources. They're going to cost you some money, but questions. And if you need to get any review books or any of your previous materials, a lot of people are asking how to study for PRITE. I know PRITE Ninja is super popular, but you really got to look into, right, I see here, Badari is answering, Focus DSM-5 questions is a great resource. Okay, awesome. And we got to know our DSM-5 definitions because that's going to be really important. But yeah, lots of questions. And if there's any topics, if you look at that blueprint, if there's any topics you're not strong on, you want to look at resources to review for those topics. All right, let's see here. When is the best time in your career to take the exam? It just sort of depends on when you're prepared. Some positions and jobs just need you to be board eligible, not board certified. So you want to check in with when you're applying to a position, you want to see to make sure that do you need to be board certified to work or do they just want you to be board eligible? That's really important to ask. But ideally speaking, you become board eligible. You take the exam when you're ready. It's too late to sign up for this September. So the next one will be in 2022. But you just, it's better just to take the exam when you're prepared. So the next one I believe is September 2022 and use your resources and do lots of questions. Will you be addressing child questions? No, we didn't really. We went into autism. That was like the really child-related question. Can you go into greater clarity on the format of the exam itself? Yeah, so 425 questions, 8 sections, and 60 minutes of break that is pooled breaks. And you can choose how you take those breaks. That's basically the thing. Best study materials for the sorts of questions seen on the PRITE exam. So PRITE Ninja is usually popular. Any question bank that you find online for just general boards question is good to do. So I'm seeing a lot of stuff in terms of the PRITE. Any of the general review books, Kaplan Sadoc is really popular. There's Massachusetts General Review for Psychiatry. You might want to get a neurology review textbook if you're having trouble with neurologic questions. But basically, you just have to, find review resources and read, but mostly do lots of questions because that's what's going to make it stick for you. But those are the major tips I can provide. And then it's just really good test taking strategy and thought process. If you can get down to 2 answers and you're between the 50-50, you're in great shape. Because if you're having a tough time, chances are you're taking this test with other really smart people and they're going to have a tough time. So if you can get down to those 2 and you pick well, hopefully luck will be a little bit on your side and you'll have that strong raw score that's going to allow you to get yourself board certified. Any other questions, guys? I really try to make this as thorough as possible in regards to those questions. And if there are no questions, I want to thank you so much for being on and spending some time with me. I'm really passionate about teaching. And again, my name is Taylor Brana, and I run a few podcasts. And the MedFlashGo podcast specifically is for medical students. We'll be creating more resources for psychiatry and other specialties as we go along. And we're going to be heading into also some YouTube content as well. So if you guys want to check some of the content we've created, you can check out MedFlashGo. That's one word. But hopefully you guys just got a little bit more into that test-taking mindset. I want to appreciate you for being on with me. It means a lot. And I also want you, of course, this is on TrueLearn. So please use TrueLearn to do plenty of questions, get yourself prepped, and hopefully you guys will have success on test day. All right. Thank you guys. Lots of thank yous. I want to appreciate you guys. And I think we'll be closing out. I'm just going to hang out here for a minute and then we'll close out if there's no questions.
Awesome. Yeah. Thank you so much again, Dr. Brana. If you guys don't know, we do have him along with the MedFlashGo podcast team that comes and does a lot of these webinars. So there's more to come. Also, if you don't have any questions pouring in right now, you can reach out to us at webinars@truelearn.com, in which we can bring those back to Dr. Brana. Once again, Thank you guys so much. If you have any questions or want to dive into more questions with TrueLearn, you can visit TrueLearn.com, where you can find more about our TrueLearn Psychiatry SmartBanks. Since we don't have any more questions, we'll go ahead and wrap this up. Again, send anything through to the webinars at TrueLearn.com if you have anything else to add.
Take care, everyone. Thank you.
Thanks so much.